Hello, everyone. My name is Jehan Ara. I'm the founder of the Nest.io, and I'm so delighted that we have today with us Fawzia Naqvi. Fawzia, let me tell you exactly, in a couple of paragraphs, what she's done and why it's going to be so interesting talking to her. Fawzia Naqvi is a former vice president of Soros Economic Development Fund, which is part of the Open Society Foundations, where she had prime shareholder responsibility for SEDF's investment portfolio in India, as well as fund investments in Mexico and a microinsurance fund which invests in Africa and Asia. In addition to this, Fawzia co-founded Open Society Foundation's economic policy think tank in Pakistan called the Institute for Development and Economic Alternatives, IDEAS for short, where she serves as a member of the board. Prior to leaving OSF in December 2016, Fawzia worked with a team to build Open Society Foundation New Economic Advancement Program. She's also worked for Women's World Banking for 5 years as a microfinance expert with responsibility for Asia. Prior to WWB, she spent 10 years with Citibank in New York, where she worked for the Financial Institutions Group for Emerging Markets, Central Eastern Europe, Middle East, Africa, and Latin America. Currently, Fawzia is an independent consultant advising several foundations on using impact investments as a tool in service of their mission. She's also a member of the investment committee for I2I Venture Fund, which many of you may know, as well as a mentor to several startup entrepreneurs and investors evaluating the entrepreneurial ecosystem in Pakistan. Fawzia has a diverse and distinguished background, as you can see, in socioeconomics. And so we wanted to have a chat with her regarding how this crisis might play out, even though most of us know that it's too early for us to tell what the unknowns are and eventually what will end up happening. So, hi, Fawzia. Good to have you with us all the way from New York.
Thank you so much, and thank you for inviting me. What an honor and privilege. And I hope we can have a very fruitful discussion about a very difficult subject, I have to say.
It is certainly, but from all the conversations that I've had with you regarding this and other things, you seem to be able to, put things into perspective. And so I thought it'd be a good idea to have a chat with you and then open this up for questions from participants. So tell me, there is, yes, it is chaotic, it's a difficult time, but there's always opportunity in chaos. Do you think the global economy is headed towards another wave of modernization with changes like online teaching, groceries, a lot of e-commerce, transitioning all into the mainstream, which was, at least in developing countries, wasn't happening as much?
I think, I'm not sure it will transition. I think it's already happening. I think that is
That's
our
true.
present. But what we're going to see also is a limitation of technology. And that really comes down to who we've considered to be visible and invisible as far as our personal lives, as far as our work lives, as far as what makes us function. And I think from country to country, we can make generalizations about who we consider to be valued people as far as workers, if we can call them that, individuals, how we regard them, how we treat them, how we compensate them, their place within society, how we have actually made people invisible who are now turning out to be the most important people keeping us alive from country to country to country, society to society.
So are we talking about healthcare workers?
Not just
Are we
healthcare
talking
workers.
about
Yeah, I was talking about people who do everything for us and remain in the shadows, right? I mean, you can say for a country like Pakistan, you have domestic help, and so, but it's not just that. It's literally people who are, farming your food, who are driving the trucks, who are placing the produce on either the telas or the supermarkets or whatever is in between. People who are making...
And we take too much, we take them for granted.
We've made...
And now suddenly
That's right. We've taken them for granted and we've made them invisible. So the
Right.
definition of essential needs to go beyond the immediate crisis. What do we mean when we say essential?
Okay.
That thinking needs to be absorbed and incorporated within each of us now. Because we are going to go through the short term crisis, then we're going to go through a medium term issue, and then we have to think long term. And
So
the
shall we dissect that? So
sure.
what do you think are the short-term issues? I think we all know that, but let's spell it out. What are the short-term issues, and how do you see going forward what the medium-term issues are going to be like, and then the long term? And what can we as a country and as individuals, whether we're in government or we're in business or we're just students, what is it that each one of us can do to make sure that we go through this coming out not only benefiting, but also being the kind of human beings that we should have been in the first place, rather than making some people invisible and some people visible. So, what do you think we should be doing right now as a country?
I mean, first of all, let me just say right up front that it would be tremendously arrogant of me to be sitting in a high rise in New York City pontificating about Pakistan. But I'm going to do that.
You worked in Pakistan, and you know Pakistan. You grew up in Pakistan. you know, so
I,
I'm asking you because you do analyze uh, the economy and you look at the social fabric of societies. You worked in Sri Lanka. So, there is a reason, because people like me would look at it very differently. And so, if we consider you an expert, so just asking for your opinion. Of course, we don't expect that, you have all the answers, but it's a discussion.
yeah.
Let's see what you think.
So let me just first say that all of us, everybody on this call, and thank you for everybody participating, we're all facing a personal crisis. I mean, there is no doubt that the most immediate issue for us as human beings is keeping ourselves healthy and alive and making
Right,
sure that our families and the most vulnerable within our communities stay alive and healthy. There is no
right.
doubt about that. At a more
None of it.
macro level, um, and perhaps even at a micro level, some of us may be facing that issue as we speak. They're in the short, I look at this as in three buckets, right? The
Okay,
short term, the medium term, and the long term. And I think
right.
there you can generalize across the globe. Um, more, in the short term, parts of the crisis are going to be more accentuated for certain countries like Pakistan. The immediate crisis is health and hunger,
Yes,
without a doubt, right?
absolutely. Absolutely.
There is no shortage of poverty and hunger in New York and in the US. And you can all see that coming to the surface. Everything is getting unmasked, everything is coming to the surface, right? In Pakistan, I think that is an immediate crisis we're facing. People are making the terrible choices, which is you die of hunger or you take the chance of dying of the virus. And a lot of people are saying, you know what? I can't see my child go hungry. I'm going to risk it. I'm going to
Right,
keep my child at home or children at home and my family at home, but I'm going to go out and earn the money, right? So
right.
in many countries, that calculation is being made by millions of people. Many of us are privileged to not have to make that decision. But from a macro perspective, what governments are facing is how to tackle both issues, right? So right now I can only lay out the problems. In the medium term, it's going to be a little bit of still resolving the issues of how do you make sure people have liquidity, they have cash in their hands, and the economy is not in an all out, you know, falling off the cliff, which it is right now. The global
Yeah,
economy
yeah.
is definitely falling off the cliff. For Pakistan in the long term, I think they've been asking for debt relief, which means that there'll be a pause on debt payments until the end of the year. There is also
Yes.
a move and a request from the private sector to pause debt payments as well. The question for Pakistan and its policymakers in the long run is, how are they going to use that fiscal space? What are they going to do? That in the time of reprieve, how will they use that time? And one can only hope they use that time, A, to continue expanding the social safety nets. One of the smartest things that Pakistan at least did in 2007, 2008 was fully back the Benazir Income Support Program, which was put together by the PPP and PMLN government in a coalition government at that time. If you remember, lifted the lid and the coffers were empty. And with the help of development institutions, they created the BISP, which became the largest social protection program in Asia. And it is considered to be one of the finest social protection programs. So thank God, many moons ago, that happened.
Right.
So what is needed is to make sure that is expanded and improved upon, because low-income families are going to need that income support, and that's an immediate way to provide liquidity to people. Okay. Hopefully the reprieve and the low oil prices will help Pakistan government make the right expenditures on health infrastructure. And health infrastructure is not only building buildings called hospitals. Health infrastructure is everything around that, meaning healthcare workers, community healthcare workers, training nurses, increasing the number of ambulances, increasing the whole idea of paramedics. So creating the network around healthcare systems.
Which is something that we will need in the long run anyway.
Exactly.
With the growing population, right?
Right. So, I can't predict all of the ways that the fiscal space can be used, but all I can say is they better be thinking about all of these three buckets now. The other thing I want to say, rolling back to the immediate crisis, is we all need to be driven by science. We need to be driven by medical professionals, medical expertise, epidemiologists, and science. And right now, tracking data is hugely important. In the US and in Pakistan, we have the misfortune of not having adequate testing or any plan at the federal level for testing, right? We don't even know the extent of the virus. We don't know who all has it, how is it spreading really, where the asymptomatic people are, and who all have they infected, right? So we don't even know the extent of the problem. What we do know is that we have a gigantic problem, and people are making terrible decisions about sacrificing their health to make sure their families are fed, right? So that's kind of how I'm seeing this in three blocks. And the countries that are going to come out of it wounded but not devastated are going to be those who address the short-term bucket properly with science and data. There's no way around that.
What about the stimulus packages that are being introduced by various governments? Will they be enough to offset the downtrend in all the traditional markets?
The answer to that depends on who's benefiting from the stimulus, right? I think one thing that is globally woken people up to is the importance of government, right? Yeah. There has been a huge trend around the world to demonize government, to downsize government, that everything government does and touches is bad. That government is corrupt, government is a dinosaur, government is lazy, and you've got to bring in private sector. Private sector technology, right? Those have been the two mantras that have brought us to the point where government has been threatened with becoming irrelevant. This crisis worldwide has shown us how relevant it is to have a federal level response. And it is only the federal level response that can respond to a crisis that is affecting entire nations, right? So who is the stimulus going to help? Is it going to be you and me as people? Or is it going to be businesses? Or is it going to be real estate tycoons? Who exactly is that meant for? And here I would like to say that, this is a really good time to ask the question, what does the economy mean? Is the economy here in service of us, or are we in service of the economy? And I hope that the economy is here to serve us, and that it's not this amorphous being that we're all providing value into for some reason, that our existence is about providing value into the economy and creating this thing called GDP. The economy is about, how we put food on the table. The economy is about dignified jobs. The economy is about everybody being able to access the health system. The economy is about having a health system, right? The economy is about not being completely on your own if a tremendous shock hits us, right? Even in good times, a person with little means is thrown back into utter poverty, utter devastation if there is one medical shock or if one person loses their income, right? Here we're having millions of people. So who is being benefited by that?
Who should be? So like the UK government, for instance, has announced this big package for startups. They're also giving 80% or so of the salaries for most SMEs because businesses are closed. In Pakistan, the ISAS program gave out rations to a large number of people below a certain economic status because they felt they needed food for their families. So I know there's no one right way to proceed with this, but what should they be addressing? Should they be addressing, there are lots of people losing their jobs. There are millions of people losing their jobs all around the world right now because businesses say, well, we are not making money. How can we afford to keep these people on our payroll? But somehow that seems wrong because where are all these people going to go? So, what is the right way forward? What are the things we can try out? Maybe none of us really knows, but there must be some way to proceed so that the minimum impact, negative impact is created.
Well, I never thought I would hear Boris Johnson sounding like a raving socialist. But it turns out that many governments are now seeing the value of their role. And, presidents and prime ministers are waking up and saying, oh, perhaps I have a job to do, right? And so I think the idea of covering salaries, 80%, 90% salaries for businesses is the right thing, because otherwise people are going to be out of a job and not going to be able to afford to live, right? In a country like the United States, where you have employer related health insurance, right? You have 22 million people out of jobs and 10 million people have already lost their health insurance.
Wow.
Right? So it is a catastrophe within a catastrophe within a catastrophe. And the idea of healthcare, affordable healthcare for all that is provided or heavily subsidized by the government is starting to look more and more attractive, right? So I think the European governments have understood that very quickly, that if they want to save their economies, they have to save individuals, not just their health situation, but beyond the immediate health crisis, what happens to people's livelihoods.
Yeah.
And unfortunately, the US is slow to recognize that, but they are. I mean, everybody's supposed to receive these $1,200 checks in the US. they still don't seem to understand that that's not even going to cover rent, health insurance, and food. It's going to be gone in
Yes.
in 2 weeks, right? So I think there is a realization that you have to have massive infusions of cash and
Right.
cash support right directly into the hands of families. That it can't be this bailing out the banks, bailing out the airlines, bailing out the real estate tycoons, bailing out the construction industry. Now, let me, step back from that. Giving incentives to large scale construction should be in the service of employing hundreds and thousands of people.
Right.
Not because your best friend happens to want his building restarted, right? So these are the kind of things we have to think about. And, governments think otherwise at their peril, because we're literally talking about people not being able to put food on the table. And this
Right.
kind of global crisis is unheard of. And what is coming is potentially, it's like apocalypse for many countries if they don't respond with human beings as at the center of everything we do. And the economy, at the center of that are people.
Right.
And over the years, we have forgotten that at the center of each economy are human beings. And how do we
We
respond to
need
them?
to come back to that.
Right.
Now, another thing, Fawzia, is that we are suddenly, technology has become the key. We need to gather data, and all that data needs to be made available to the government so they can track where everybody is going, what they're doing, especially those who have tested positive. Will this crisis be a turning point in how much surveillance and control governments are allowed to have and to use? Because lots of people who were afraid to share their data with governments now suddenly are only too happy to do it because they think that it will help during the crisis.
Well, I mean, here's a dirty little secret. I mean, that thing you hold in your hand all day long called the phone is spying on you. You know,
Right.
while you're sleeping, it is picking up data and pulling it, and we don't even know where it's going.
Right.
Um, some of these tech companies are 10 times more nefarious than what we think the government is going to do with that. However, they have also participated with governments long before the pandemic to surveil, to do a level of thought control, to tighten the grip on free speech, free movement, congregating around causes. We've seen that over and over again across the globe. We have got, tyrannical democracies that had emerged long before the pandemic. And we can probably safely say that we are in a pandemic, perhaps because we had these populist, narcissistic leaders who either tried to downplay and control the transparency around what this pandemic was or what this illness was until it kind of got out of control. And
Yeah.
now we see that there is also a desire by the same narcissistic, tyrannical, dictatorially inclined leaders to use this time as a form of tightening control. So in the medium term, we have a huge risk where a surveillance globe, not a surveillance state, but a surveillance globe is just going to get more enhanced. So now we run the situation where we cannot leave our houses without our temperatures being checked.
Yeah.
We cannot leave our houses without our blood being drawn. We cannot leave our houses without a facial recognition. I mean, all sorts of dystopian kind of ideas are coming up, and it's not like we haven't seen those, right? We've gone through the 1930s and 1940s where people who had disabilities or any form of weakness were considered to be not worth keeping alive. You know, we've gone through, the world has seen awful times. So it's not like we can say, oh, you didn't know this was coming. We have seen forms of this before. So I think it's a very valid concern that every citizen of the world should have is, let us not let this horrendous pandemic allow a further illness to develop, and that is of, you know, what Camus was really telling us about the plague. What is the plague? The plague is not just a disease that we contract, but it is what is inside of us and the impulses inside of us. So I think every citizen of every country needs to be alert to that.
Right.
You know, without saying, oh, I'm not going to, you know, go to the hospital, or I'm not going to have my temperature checked, or, you know, I'm going to be the super spreader. You know,
no.
But there is a risk to failed and being, you know, oppressed. Yes.
And should we be expecting a global recession?
We are there.
We're there already.
We are there. The question is, are we heading into a global depression? So the fall in the oil price yesterday,
into negative,
it indicates a longer term outlook. I think what it's saying is, who is really going to get on planes again? Who is really going to be going on vacation? Who is really going to be consuming all this oil supply? Not into 2020, but out to, you know, a very long time. So the oil industry and the airline industry is looking at a slowdown that could be heralding a global depression.
And how do you think this might impact countries like Pakistan?
Well, I'm not sure it's going to be good. That's for sure. But again, I go back to, somebody better be staying awake at night worrying about that. And here comes the long term. If you are given the fiscal space by the donor world and the international organizations and by private providers, if you're holding, you know, if your creditors are the private banks, for instance, or investment banks, if you're given that fiscal space, what are you preparing for instance, right?
Yeah.
And that really needs to be talked about now. And there are much sharper minds than mine who need to be worrying about that today. You know, don't wait for that to hit you. You know it's coming, right? It's like standing somewhere and seeing, you know, the ice breaking and it coming at you. It looks like it's very far away, but you can see it coming, right? So what are you going to do at this point? So that's,
they need to think about it now.
Correct.
And are we talking about governments? Or are we talking about their advisors? We're talking about the private sector?
I think everybody needs to prepare, but the lead has to be taken by
the government,
economic managers at the federal level.
Right.
And they have to work in consort with the provinces. People, at some level, you have to bring it all together with some level of accountability. You can't have provinces, you know, running their own shows that are out of concert with everybody else. Because ultimately you are interconnected.
Absolutely.
And if that's not happening, it shows a failure at the federal level. And if you want to get really scared, just look at what's happening to the US, right? The US is providing the world a terrific example of how not to do things, of what incompetence and failure looks like, right? And I think governments around the world, it doesn't matter what income level you're at, there are some basic lessons you can learn. And one thing is, you need to build credibility and trust among your people.
Right.
You need to bring credibility and trust among people who are leading the provinces. They need to say, okay, you know, we're all in this together. There is really a we here, and if we don't come together, we are all going to be damaged. And I'm afraid that in a country like Pakistan, we're not there yet. We're certainly past the point of doing that in the US. We are really, as states, on our own.
Yeah. Yeah.
So hopefully, you know, Pakistan will understand that. And again, you need to be data driven, you need to be science driven, you need to be health driven in the short to medium term, but you also need competent economic managers to understand the moment that they are in and to use that fiscal space in a way that you will come out wounded, but you won't come out needing an amputation.
Absolutely. Okay, let's look at the positive part, if there can be a positive part. Um, are there opportunities for countries like Pakistan in the current environment, something that we can capitalize on right now for the benefit of the country? Because yes, there are a lot of things that are going wrong, but there are new opportunities that are being created. Is there something we can do as a country to make sure that the damage is not as bad as it could be?
Jehan, I would go back to keeping it simple and basic and old fashioned, right?
Okay.
Pakistan has built the largest and one of the best social protection programs in the world. That is a
Right.
fact. And Pakistanis should be very proud of that. Okay, it
Right.
predates PTI, it predates Imran Khan, it goes back to 2008. Okay, Benazir Income Support Program was created precisely for disasters that we are facing today. So what is the opportunity? The opportunity is to expand that, to improve that, and to make sure that you are not limiting it now to an income segment that you assumed was the most stressed, that you may want to think about it a little bit more broadly now, because there are a
Right.
lot of people who are going to fall into an income sector they didn't think they were going to fall into. How do you prepare for that, right? That needs to be done. The other thing that needs to be looked at is, you know, Pakistan produces, healthcare products, surgical
Yes.
goods, personal protective equipment, PPE, which you're hearing about everywhere. There is
Yeah.
a massive shortage of PPE, right? In the medium term, governments around the world are going to want to stockpile PPE.
Mm-hmm.
Pakistan has a huge opportunity to play a role in producing that. We have a gigantic textile industry, right? How do you repurpose production to make face shields, to make gowns, to make the booties, to make the gloves, right? How do you do that? I mean, Salcott is known for many of these production units. How do you make sure that they get the support to expand their production? Okay, to take it up a notch. It's a real opportunity.
Right.
Second thing I'm thinking about, if you want to think about innovation, is in our agriculture, right? How do you make sure that you are self-sufficient, you remain that way, and that you improve the yields? You got to think about yield improvement now. You
Right.
have to think about supply chains. How do you make sure the supply chain remains open? Where are the problems in the supply chain? And how do you encourage and how do you incentivize the supply chains to be smooth? Now's the time to think about that. One
Right.
thing that will happen is the whole question of what globalization means, right? The fact that countries were dependent on other countries for their basic health needs, right? The fact that we are now dependent on flights from China bringing in basic healthcare equipment, right? At a personal level, I have a cousin who's on the front lines, who was deployed in the ER. And he was desperate for an N95 mask. And they were going into the ER at the top of the crisis without an N95 mask. And the fact that there was nothing anybody could do to help these healthcare workers until we didn't get the production from China, or we didn't get it from Turkey, or we didn't. So, you know,
So is
something,
this going to lead to self-sufficiency or
it has
the
to.
need for self-sufficiency? Because we have for a long time depended on a global supply chain, right? But this might have proven that to some extent we need to be self-sufficient as
To such
countries.
an extent, you cannot go back into another dynamic. Look, we are not going to be out of this for another 18 months, if that. There is no coming out of this unless we have a vaccine. We may have a
Right,
therapeutic that might blunt the force of this, but until you don't develop a vaccine, you're not coming out of this, right?
right.
Again, I say, what are you doing today to, prepare for another surge?
Yeah,
Fine, we flatten the curves, we go down to maybe 200, 100 deaths per day, maybe less. Everybody starts to resume their lives. What happens again if you don't have the PPE, if you don't have the ventilators, if you don't have what you need, if you have food shortages, what do, right? How are you preparing now for all of that? And making sure that you will never be not dependent on the global supply chain. But how do you make sure that you're not dead
yeah,
because you can't, or a country like the US comes in and hijacks the equipment, right? I mean, a supply that's going to England gets, hijacked by the US. A supply going to Germany gets, hijacked by the US or another, a big country that comes in and just takes your supply. Those things are also happening. And, it's how do you make sure you don't get caught in the zero sum game? And I
right,
think the responsibility is on federal governments to make sure they can be accountable and answerable to their people, that they are preparing. Now that they know, now that
yeah,
you've seen, there is no excuse not to be prepared.
right. Okay, so the next problem now, China is one of the countries which seems to be coming out of this, although we see new cases coming up, but they're trying to get back to normal. But they see that there is a reluctance amongst their people to go out and enjoy themselves. The walls are still very sparsely populated. People are not really going to restaurants. Do you think this pandemic will change people's habits permanently because they'll be scared to do the things that they normally did? Is it going to result in a habitual change?
I think until you don't have a proven vaccine, I think fear will drive people to make decisions. And, I think those are rational decisions. If you think about yourself, how many of us are willing to get on a long haul flight? How many of us are willing to go to a restaurant and just, be sitting next to other people who we don't know, right? How many are people willing to get on a subway in New York, for instance, right now, in the same sort of crowded way? How many people are willing to go into offices that have open spaces? So, fear is going to drive behavior at this point, which is not irrational. It's very rational. Until you don't have a vaccine that's proven, you are not immune. There is no age group that's immune. There is no ethnicity that's immune. There is no religion that's immune. It affects, it infects and kills indiscriminately. Of course, those people with comorbidities, with heart disease, cancer, diabetes, people who are smokers, people who are vaping, are facing a higher risk of this becoming a calamity.
Yes.
Most people will get quite ill and come out of it. Apparently, they can recover at home, but it's pretty nasty. So people are going to act out of fear, and our lives are going to change and have permanently changed. And we all have to be prepared for that, I think.
Okay, so what is next for us as not just as the world, but more the developing countries? What should we be doing next to plan for the next? Not, as you said, it may go on for 18 months, 2 years, and it may be cyclical. It may come back. So, what are the things other than healthcare that's essential? Healthcare is something that we must all be focusing on right now because this is something that will affect us. What else should we be doing, in the longer term? Short term, you've told us exactly short term and midterm what government should be doing. But in the long term, what are the things that we should be focusing on?
I think the focus again needs to be on how do you put policies in place that mitigate the shocks on
So,
everyday
do you
people,
think universal basic income and
which is
universal health care
which is what
is that?
exactly. So I mean,
So universal basic income is basically what the Benazir income support program was all about, right?
correct,
It's a
correct.
basic income.
So during
Um,
that
but
program, right, they get the people who fall into that category get a stipend every month, and it is a
right,
female who in the household is considered the head of household. So the one way the
right,
BIS, if I'm still up with what the conditions are, one thing that differentiated it from others around the world was that women were considered the head of the household, right? And they were the ones who were the beneficiaries of the money. And everybody had to have a CNIC number in order to be the beneficiary. That also brought people into the visibility of the formal economy. And it had other benefits as well. And having women be the head of the household for this purpose had all sorts of other benefits. So definitely that is something that is proven to work. It is beneficial. And again, expand that and see how that needs to be improved upon. So that is not just Pakistan. Every country
that's
is
everywhere.
about
Hmm.
that, right? Every
Right,
country. And countries like the US had that. There are many um, parts of the US that have a form of that already. It's not unique,
they
right?
just have to expand it, right?
That's right. But the demonization of any kind of social benefit or social protection, there was an utter demonization of that, right? If you were getting any benefit from a social protection program, you were poor and lazy and unworthy, right?
Right,
You were not pulling yourself up by the bootstraps. That
hmm.
was the narrative from the UK to the US and many places in between, which is mostly a pond. But I think that has now gone away. You cannot say that 30 million people out of a job or even more by the fall are just a bunch of lazy people wanting to be on the dole. That narrative is absolutely rubbished. And Pakistan is ahead of the game because we have a social protection program that has been
Right.
going on for more than a decade now, right? We
But
know.
it's a very small amount of money, which is not really sufficient anymore to really even cover food expenses.
But that's why
So they would have to expand it. They would have to expand the
right.
amount and the reach,
That's right.
both, right?
And much more, I think, imaginative ways need to be brought to bear as to how to expand it. You know,
Right,
in the short to creeping into the medium term, the federal government may actually need to be providing the food, as in producing food and delivering it door to door,
right,
right? How do you create a network of people who will do that, who will distribute that? Um, there's a lot of, of lessons to be learned on how Ebola was handled in West Africa. And
okay,
there was a large cadre of community health workers, as they were called, right? They had very basic training. They were from the communities, and they literally went door to door to door, and people knew who they were. There was a level of trust in these people, majority of whom turned out to be women, who understood how to protect themselves and to be safe while they were going door to door to door to figure out who was ill in the household, giving them basic information of how to protect themselves, what the needs were, and then making sure those needs were provided for, right? So that's the kind of expansion, and those are the kinds of thinking that are going to have to be done. It's going to have to be done mohalla by mohalla, to tell you the truth. It's a gigantic undertaking in a place
It
like
is.
Karachi with 22 million
Extremely.
people. Now is the
Yeah.
time to think about it, about how do you do that, and
Yeah.
like I said, there's smarter people than me and this is where technology comes in, right? This is where you can use data, you can use text messaging, you can use, a form of easy pesa, you can use so many different things that are now par for the course for people. They're used to that.
Actually, digital payments and e-commerce are really growing in Pakistan because of the crisis, because people don't want to touch money. They don't want to, they can't go out and buy goods. So they are trying to order online, and it's all begun to happen. I think it's a good thing for the e-commerce industry, but it's also a good thing for people who really can't leave the house very often to go and buy the things that they need.
i'm
So tell
going
me, sorry,
I'm
yes.
wager that a majority of your country is not going to be able to order food online, right? But what they are going to be able to do is to receive messages of where they can pick up food,
Yes, yes,
right?
absolutely.
And that's important. Or that somebody is going to knock on their door, and for them to make sure they answer questions and receive that food from this person. Okay, so
Absolutely.
that can be done. And that is the kind of, I'm talking about now, very low and high tech coming together. The
Right,
low tech meaning people. You're going
right.
to need a lot of human beings. One thing Pakistan has, a
It's a
lot,
lot of human beings.
a lot of young
Yes,
people, a heck of a
very
lot of young people who know how to use technology, even in a
absolutely.
basic way, right? How do
Yeah.
you deploy these people as community workers? You want to call them health workers, you want to call them food distributors, all of that, right? In a much, and let me just say, before somebody brings up whatever it's called, the lion force, tiger force, cheetah force, whatever, depoliticize this, right? The
Yeah.
person working in Karachi should be able to be rotated around somewhere else because they've learned something and they can go and train other people, right, in a safe way. They may then be deployed whenever movement is done safely,
Yeah.
right? So
Yeah.
it can't be that, these people are wearing t-shirts with a certain party slogan on it. That's the
No.
easiest way to create distrust. And right now, you know, depoliticization is the best way to win re-election.
Yeah. There's a question here from Jamal. He says, is it also going to deglobalization and effect of it on global trade, that is import and export? If we are moving towards global depression, that seems to be the next global impact.
Yes, I think we are looking at global trade being impacted. We are already in a trade war situation by the two largest economies in the world, right? We also have to remember where we were before the switch was flipped on called a pandemic. We were already in a pretty bad situation.
Yes.
We were extraordinarily polarized. We had trade wars going on. The international community had all but been diminished. International organizations had been trashed, right, are continuing to be trashed. So, yes, what we could see are more tight trade blocks, right?
Right.
where countries in the region become tighter, where, and then they compete with another region. I don't know, honestly, I don't know where it's going from that level. But I do foresee more inward looking postures by the world community, right? Everybody's talking about we're all in this together, we're all part of the human race, but I think the natural tendency is going to be the me first. How do I protect my flock and see other people as a threat? Ironically, the Africa region was telling Europeans, please stay home. You think we're immigrants you want to block? We're building the wall against you, right? I mean,
Quite right.
the world kind of flipped over in
Yeah.
that,
Yeah.
right? The countries are like, no, maybe not. Thank you, but no thanks. Here's my bank account number. You can wire the money, but stay home.
Okay, I think we're running out of time, but as a last question, if we were to look at any country who's doing it right, who would you suggest we follow? Who do you think has done it the way it should have been done?
Germany and New Zealand, I would think, come to mind. And I wonder what they have in common. What could it be?
Women leaders.
After,
always think of the community and the families and the individuals rather than of power and
where ego and narcissism is not how you lead, right? You're leading with science and data and calm, strong leadership. I mean, Angela Merkel is a scientist, right? I mean,
yes,
knows more about this stuff than most people do. I think that those two countries are definitely examples, and I'm sure there are more, but those are the ones and the ones that have dealt with it very badly are the ones who have narcissistic populist presidents. If you look at how the US and the UK mirror each other, it's frightening that you had both countries where the leaders were basically dismissing this as it's going to go away, it's not a problem, get on with it.
Yeah.
Whoever is complaining about it or bringing this up is spineless, weak, and conspiracy, right? So I think we can see very clearly where the good leadership is and where the very bad leadership is. And I think in Pakistan, you can say, when I grow up, do I want to be like that or do I want to be like that? Because
absolutely,
that choice means hundreds of thousands of people dead or not dead. It's now that simple. And as you can see in the US, we are now at 42,000 dead in 4 weeks.
Wow. Yeah.
It's now coming close to 15,000. I'm sure it'll cross 15,000 by the end of this week, if it hasn't already. It's not a good example of leadership. But I have to say, Jehan, if there is a silver lining, it is finally that the public sector matters. The federal government matters, that diminishing the state is one of the most dangerous things that you can do for a country. And in a moment of crisis, the only effective mass response can come at the federal level.
But should they not be talking to scientists and healthcare workers?
Exactly. So my comment,
economists?
The leadership part is where they bring people together who are experts under their aegis, right? So
right.
You shouldn't have the state bank governor responding to a health issue. His job is to manage the monetary policy and worry about the debt situation and what's happening to your currency, right? That's his day job. Yeah. That's what we're worrying about. There should be epidemiologists, infectious disease specialists worrying about what the data and what the science is telling us, right? And in each phase of this, you need different kinds of expertise. But the people need to be doing their day job. It can't be helter-skelter and chaotic. You have to be methodical. And only the federal government can provide that, provided it remains depoliticized. it must be depoliticized. You can't have the Sindh government ignoring something because you have political statements attached to somewhat medically sound commentary, right? It has to be people who are trusted and respected, and they should be the ones speaking. And if the politicians are speaking, it's after consulting with the experts. There is no way around that now. Again, do you want millions of your people to be dead? If you want that, go ahead and wave your party flag. If you want to be a leader that is known to have saved millions of lives, then depoliticize this and bring on the experts and let them speak. It's a very simple. And again,
Simple.
look at the US. You know, don't let your sons and daughters grow up to be what we're seeing in the White House. That is a very bad way of leading from the front. It's called not leading at all. And we are now looking at 60,000 to 100,000 dead by August. That's what we're looking at without any exaggeration. So, you know, as they said in the old ads that we grew up with, fark saaf zahir hai.
Absolutely. Thank you so much, Fawzia. I think I learned a lot. I'm sure a lot of people will be left with something to think about. I hope our government representatives were listening and that they take away something from this that will help them make the right decisions.
Does anybody who's listening have a question? Do we have anybody who has a last minute thought? Or
No, I asked the questions while they were coming in, so we don't have any other questions right now. Oh, there is one more. Oh, that only says, thanks, very interesting discussion. Wasn't a question, just a comment. So a lot of the things on Facebook are just comments, not questions.
yeah,
So thank you very much. We may talk again in a few weeks. Let's see how things go. Meanwhile, just stay safe, take care of yourself. You know, things in New York are scary, and things in Pakistan look as if they're becoming scary as well.
Yeah, I just want to leave everybody and reinforce the idea that the economy must be in service of people and not the other way. And now it's to keep human beings at the front and center. And I must say, Pakistan is one of the most philanthropic and charitable populations in the world. That's news. And that has kept families alive all these decades.
And they're still doing it.
And they're still doing it.
Yes, but this epidemic, this pandemic, you've seen all of them come out and they're still doing it.
But Jehan, what I'm going to say is that it's given what we are facing, it is not going to be enough. And the government must play an outsized role in saving lives from an infection perspective and putting food on the table. There is no amount of individual philanthropy that is going to be able to fill that gap. You can do it.
No, it's too big. It's too big. There's too much to be done.
In Pakistan, it's going to be a rolling crisis, right? You do not know where the infection is. There are not enough tests. We do not know because people are not showing up to the hospital to die. We do not know what is going on. And therefore, it is absolutely mission critical that the federal government get its act together. And if there's one thing people in Pakistan can do and young people can use their technology to do is to make sure that you hold the government to account and make sure you have your voices, heard in whatever way you can on this front.
Absolutely.
The leadership you have, they need to step up.
They do. Thanks a lot, Fawzia. It was great talking to you.
Pleasure talking to you, and I hope it was useful. Thank you, Jehan.
It was. Thank you so much.
Take care, everybody.